السلام عليكم ورحمة الله وبركاته والصلاة والسلام على أشرف المرسلين سيدنا محمد وعلى آله وصحبه أجمعين دمان داودياشا تلفزيون كاوين كالسن نغا داونيا waxaan idin leenahay habeen wanaagsan caawa oo axad ah bisha abriilna ay tahay 24 waxaan halkan idinkaga soo tabinaynaa barnaamijkii toddobaadlaha ah qiimaha qaayaha lan lahaa ee lagu magacaabay gurmad barnaamijkaasi oo caawa uu marti inoogu yahay khabiirka weyn ee ku takhasusay cudurrada haweenka Dr. AHMED ISMAIL waxaan rajaynaynaa barnaamijka inaad si toos ah ula socon doontaan qaybihiisa dambana aad ka qayb qaadanaysaan idinkoo weydiinaya wax allaale wixii su'aalooyin ah oo aad doonaysaan Dr. AHMED.
Yes, sir.
I would like to welcome you again to Kalsan TV Gurmat program.
It's always a pleasure of mine to be invited by Kalsan TV and to discuss various matters which is quite important to our societies.
Thank you very much. Tonight, the topic we would like to cover is pregnancy and problems related to it.
Yes.
Hundreds of thousands of women die every year. Correct. As a result of complications during pregnancy and childbirth. Tragically, statistics show that 33 women die every hour as a result of these complications. 90% of these deaths occur in the poor countries. In poorer countries of the world, and I mean developing countries. And it is as a result of women not having access to skilled health workers. Also, they're happening as a result of inadequate medical supplies, inadequate medical facilities. As an expert in the field of women's diseases, a world-class expert who has a depth of knowledge and experience, I would like you to talk about what are the common as well as specific health problems women face during pregnancy in this country and outside. Thank you.
Well, Bismillah ar-Rahman ar-Rahim. Obviously, when we talk about pregnancy, we have to divide the pregnancy into 3 stages. The first stage, which is called first trimester, the second stage, which is called second trimester, and the third stage is the third trimester. When we talk about first trimester, which is basically the first 12 weeks of pregnancy, women do have a certain problems which can rise as a result of their pregnancy. Sometimes the pregnancy starts and the woman starts having bleeding. She goes to the doctor, and the doctor asks her to go back home and rest without any further investigation carried out. And that is something which can subject the woman to health hazards. You cannot do that. First of all, we need to know why the lady is bleeding. Number 2, if that bleeding repairable, i.e. we can treat, then we have to start treating. Fortunately, many centers in this country and in the world have what we call a conservative management. Obviously, conservative management is okay, but unfortunately, in the early pregnancy, it is not good enough not to support the pregnancy if it is viable pregnancy. The word viable pregnancy is if there is baby's heart. Support the pregnancy with some progesterone injections or tablets or rectal suppositories. This is unfortunately lacking in a lot of places and a lot of centers. And that can subject the woman into health hazards, anemia, and so on. Number two, if the woman in early pregnancy started experiencing blood pressure increase, it's no good to say go and rest and come back again and have blood pressure checked. This woman, once she started having high blood pressure in early pregnancy, that means she could, that high blood pressure, if it's not controlled early enough, she can go into what we call it toxemia of pregnancy or hypertension of pregnancy, and that can lead to preeclampsia. A lot of women know about preeclampsia in the world, which is grateful to the progress in the healthcare in Britain for declining the incidences of preeclampsia in pregnancy. Unfortunately, that is not the case in most of the third world nations. There is an excess cases of preeclampsia, and that is actually one of the major cause of death in pregnancy.
And you said, for example, there are common problems that arise during the pregnancy, and I think, for example, if the woman develops high blood pressure, and if it is not
must be controlled.
Must be controlled.
Must be controlled.
This is not something. It can escalate and
yes.
become toxemia.
Toxemia of pregnancy. Exactly, sir.
Yeah.
And then we comes to another factors, which is diabetes in pregnancy. Women can be subjected to diabetes, but particularly if they have a family history of diabetes, or they shown some history of diabetes in their previous pregnancy, and these cases must be controlled from very early stage of pregnancy. If not, the woman can have a severe hypo or hyperglycemia in pregnancy, and that can lead also to death in pregnancy.
Okay, can I say, for example, if a woman comes from a family with a history of diabetes,
yes,
meaning she's more likely to
yes.
get a form of diabetes,
yes.
call it gestational
diabetes, absolutely.
And the main duty is both on the husband, herself, and the medical profession is to keep the level of the sugar to normal level.
Let me tell you a statement.
Yes.
Very important statement for all our women who are listening to us, who had a diabetes in their family, or they had a previous history of diabetes in pregnancy, which we call it gestational diabetes. These women, if they are well controlled, they are as good as any woman without diabetes. And that is very important.
Yeah,
if it's not controlled, this woman is subjecting herself and the baby into major problems in pregnancy.
Okay.
Then after the diabetes in pregnancy, we're talking about something very interesting.
Definitely.
We just tell you about that interesting skill.
Definitely. Thank you, Dr. Ahmed. walaalayaal sidaa la socotaan caawa waxaa marti inoogu ah barnaamijka gurmad ee toddobaadlaha ah dhakhtarka weyn Axmed Ismaaciil oo ah khabiir isagu ku takhasusay cudurrada haweenka. dhakhtarku wuxuu cawada ka hadlayaa pregnancy-ga iyo amba uurka haweenka uurka leh iyo dhibaatooyinka la xiriira. waxa uu taabtay laba xaaladood waxyaabaha haweenka uurka leh soo saameeya waxaa ka mid ah blood pressure-ka oo isu bedeli kara macnaha xaalad markaasi khatar gelisa sixada gabadhaasi uurka leh haweenta uurka leh. marka waxaa muhiim ayuu leeyahay in la kontrolo ama gacanta lagu hayo oo oona faraha ka bixin. waxaa kale uu dhakhtarku sheegayaa in haweenta uurka leh haddii ay ka dhalatay qoys markaasi iyo macnaha macaanku uu ku dhacay ama aabbaha ama hooyada amba awooga ama dad ka tirsan qoyskaasi, waxa ay inta badan ay suurtagal ah in cudurkaasi macaanku iyadana ku dhici doono. waxaana la yidhaahdaa gestational diabetes oo ah kan waa nooc ka tirsan macaanka oo laga helo hooyada uurka leh. waxaa muhiim oo leeyahay xaaladdan sidii tii hore in hoos loo dhigo gacanta lagu hayo sokorta levelka sokorta dhiigeeda waa in la geeyaa target markaasi go-an. waxaan ka hadlaynaa 100,000 oo haweena ayaa u dhinta dunida dacaladeeda oo ku dhinta ayaga oo dhalaya ilmaha ama uurki leh. waxa ay sheegayaan statisticsku amba wararka rasmiga ah ay sheegayaan in 33 haweena ay dhintaan saacad kasta ay u dhintaan complications oo ku yimaada xagga pregnancy-ga iyo childbirth-ka amba maaragtay dhibaatooyin ku dhaca uurka dhinaciisa iyo dhalmada. 99 haweenkaasi dhimanaya waxay ku dhimanayaan wadamada iyagu faqriga ah soo koraya. waxaana ugu wacan ayadoo dadkaasi aynan u helin fursad macnaha xarumo caafimaad oo awoodi kara inay la tacaalaan dhibaatooyinka markaasi haweenkaasi soo wajahaya. waxaa kale oo dhibaatada geerida keenaya ayadoo aynan jirin shaqaale caafimaad oo si dhaba wax u bartay oo iyagu awood u leh dadkaasi inay badbaadiyaan. waxaa markaa jecelnahay dhakhtarka inaan ku laabano kana faa'iidaysano. Dr. Ahmed, just you touched one of the things I would like to say. I mean, is pregnant woman has a lot of things, lot of changes taking place within her body.
Let me just explain something very interesting here, because we need to make it very clear to the women. In early pregnancy, when the woman is experiencing some blood, sometimes she thinks that she's having a period, and she doesn't think she is pregnant. And this is one of the important things is there is a physiological changes. She say, I feel like pregnant, I feel my breast is enlarged, I feel nauseated, I feel sick, I feel like pregnant, but I'm having blood. This woman must have a pelvic scan straight away, ultrasound, to make sure that she is either pregnant and that pregnancy need to be assessed properly or not. Secondly,
there is a bleeding.
Secondly, every woman, she must, as soon as she knows that she's pregnant, she must have a scan, ultrasound. She must. This is something like a rule of thumb, because without knowing that, number one, early scan, ultrasound, tell us whether it is a single pregnancy or not. Number two, is it multiple pregnancy or not? Number three, is this pregnancy is viable, i.e. normal pregnancy, or she got what we call blighted ovum?
Okay. Dr. Ahmed waxa uu leeyahay qof kasta, hooyo kasta ama gabar kasta oo xaamilo ah amba istiraahda markaasi uur baad leedahay waxa ku waajiba inay marka hore samayso scan, pelvic scan.
Yes.
Amba maaragtay miskaha ay mataqaanaa iska saarto macnaha laga fiiriyo oo scan la saaro. waxaa markaa uu leeyahay waxay suurtagelinaysaa professionalska ama mutakhasisiinta u saamaxaysaa in la ogaado marka hore inay waxaan yihiin multiple pregnancies ama meeshaasi more than one baby is carried. Yes. Twins like or triplets.
Yes, absolutely.
In maaragtay qofkii ay wado macnaha wax ka badan hal cunug amba mataane amba waxaan niraahno tripletka ama kasii badan ba dadka Ilaahay siinayo. waxaa kaloo muhiim ah ayuu dhakhtarku leeyahay iskaankaasi muhiim u leeyahay about viability of the babies. macnaha in uu hubiyo waxani inuu yahay macnaha janiin caafimaad qaba ama mid wax ka dhiman yihiin oo dhibaato ka taaganta. marka waxaa muhiim ah qof kasta haweeney kasta iyo gabar kasta oo uur leh inay marka hore ku dadaasho inay mataqaanaa isku samayso testiyada muhiimka ah.
Hagabaal, the things which is really not really very pleasant. When the woman is in early pregnancy, go and see a doctor or a family doctor or a GP or whatever, and then they tell her that your nearest scan is going to be in 13 weeks pregnancy or 14 weeks pregnancy. For God's sake, this is very, very serious. Because we have something called ectopic pregnancy, i.e. pregnancy outside the uterus, and that's very dangerous. Secondly, Sometimes they have something called blighted ovum. Pregnancy there, but there is no baby inside. It's called. Thirdly, a woman who has early pregnancy in the cervix is very rare. It's called cervical pregnancy, and or scar pregnancy for a woman who has had previous cesarean section. Very dangerous, very serious. And also can tell us whether there is pregnancy normal in early stage or not. If it's not, then terminate the pregnancy. If it is abnormal pregnancy. If it is good pregnancy, then we can advise women early enough to carry on her instructions for how to eat and how to do exercise and how to protect her pregnancy. And if there is elements of high risk pregnancy, such as women who has had several cesarean sections and then they got pregnant. She doesn't want to get pregnant simply because she is worried about her scar. It can rupture. It can put her life at danger, at risk. Then she comes to the doctor and say, I need to not to have this pregnancy because it is dangerous for her life. All these factors will not be assessed unless the woman is seen early in pregnancy, checked properly, blood studies and all the tests carried out, pelvic ultrasound carried out properly, assessing the pregnancy, instructing the woman how to go forward with her pregnancy.
Okay. I think Dr. Ahmed sida maqlaysaan intiina badan la socotaan waxa uu ka hadlayaa muhiimadda ay leedahay ahmiyadda ay leedahay in maaragtay haweenta uurka lihi ay macnaha la jeegareeyo oo dadka professionalska mutakhasisiinta dhaqaatiirtu ay ogaadaan waxa jira ayuu leeyahay marmar waxa jira intay u tagto GB amba dhakhtar uu ku yiraahdo iskaankaaga ugu soo horeeya waa 12 usbuuc taasi ma wanaagsan u leeyahay waa ka hor in isla markiiba la helaa qaab maaragtay haweeneydaasi loo ogaan karo xaaladeeda iyo waxa ay uurkeedu waxa uu yahay waayo waxa dhici karto ku leeyahay pregnancy amba xamli amba uur outside utraha oo ka jira meel ka baxsan rahimka ama ilma galeenka waxa kaloo jira pregnancy jira uur baa jira with no babies amba caruur aynan jirin caruur dhanba aynan jirin uurna jiro waxa kaloo jira C-sectionka amba dadka iyagu lagu qala caruurta oo sida dabiiciga u dhali waay waa muhiim in waxaasi la ogaado haddii aan qaybta hore la ogaana markaasi waxba lagama qaban karo waayo ogaanshaha waqtiyada hore stageska ama maraaxilka ugu horeeya ee hooyada uurkeeda waqtigiisu waxa uu u saamaxayaa in haddii uurkaasi caadi yahayna markaasi la siiyo nasiixadii iyo qaabkay u dhaqmi lahayd iyo exercise-yadii ay qaadan lahayd haddii wax jiraana la daaweeyo. Dr. Ahmed, I would like to say, for example, a lot of people do not realize men go and marry women, they expect a perfect home. Women get pregnant. As soon as the pregnancy takes place, there is a backache, headaches, high blood pressure, itching, leaking nipples, pelvic pain, nosebleeds, sleeplessness, and incontinence. There are major biological changes taking place within the woman's body, which sometimes lead to all these. Yeah, I think there are also constipation, feeling faintness, feeling hot, means varicose veins is swollen. All these. I'm not talking to you as a medical profession, as a man who married, who raised, who had children, and who raised them. Would not be good to inform our heads of households that they should take these conditions into consideration.
Of course.
Because a lot of reasons why our family unit breaks down is that the woman is dealing with these
by herself.
Yeah,
yes.
By herself. And we fail to realize.
Exactly.
What can you tell us? You mentioned it a very
Oh, you want me to tell the man?
And these.
Sir, if you are a married gentleman, remember, the woman next to you is not just a factory of producing a child. She is a female. She is a human being. She's as good as you are, even better. And remember, she is the one who is your mother, your sister, and your daughter. Treat her with greatest respect. Her symptoms must be taken with utmost care, because in pregnancy, every symptoms the female feel must be taken seriously. You cannot ignore it, whether it is constipation, whether it's headache, whether it's blurred vision, whether it is nausea and severe vomiting, whether she is weakness, tiredness, fatigue, restlessness. All these factors can be of an early signs of a very serious problems to come. If we can see the woman early, if we can assess the woman early, if we can, by the way, we mean a gynecologist with a good experience in maternity. These are the people who can stop early problems and lead women into a proper, healthy, forward pregnancy with a family which will never break down.
Definitely. waxaa ku jira qof baa khadka ku jira. We are welcoming a caller is on the line. Please welcome. Soo dhawaad walaal.
Okay. Hello. Hello.
Walaal waa ku maqlaynaa. Ku soo dhawaad barnaamijkii gurmad.
Okay. Well, waxa la yiraahdaa magacayga shacab dibaa la yiraahdaa la dhanbaan joogaa.
soo dhawaad walaal Caasha.
waxaan ku weydiinayaa dhakhtarka, waxaan weydiin lahaa gabadhaan dhalay oo inta ilma qaaday, ilmihii isagoo 3 bilood ama 2 bilood meelahaas ayuu wuxuu ku beermay tayuubka makaanku ku beermay. markiiba way ku degdegeen oo way tayuubadii mid bay jareen. inantii diba u dambaysa ilmo dambe may qabsanin, may qaadanin. bal dhakhtarka ii weydii waxa xalku yahay.
Okay. Sister Asha is calling from London, and she is asking a question on behalf of her daughter. She said, my daughter had unnatural conceivement. The pregnancy took place outside the uterus and on, I think, collateral tubes. And I think she said that they rushed into maybe operation, and ever since she didn't succeed
to get pregnant. Yes, this is a very, very common situations when the woman have an ectopic pregnancy, and as a result of the ectopic pregnancy, 2 things can happen. One, either the tube which she has been pregnant in was only one working, and the other tube is not working, or as a result of the bleeding inside the abdomen due to rupture of the ectopic, adhesions can take place, and the adhesion itself is the one who is causing a blockage of the other tube. So any woman who experiences late pregnancy after ectopic pregnancy or after pregnancy outside the uterus, she must have a full investigation.
Okay.
And the main investigations here is pelvic ultrasound, number 2, laparoscopy to check the pelvis following the ectopic pregnancy, whether there's any adhesions, this could be removed, whether there's any blockage to the tube, could be rectified. If not rectified and it is beyond treatments, as a result of severe adhesions, then she will have to go for an IVF. That is very important because people sometimes keep waiting and waiting and waiting until they are getting old, and then they will go to rushing to the doctor and say, well, look, I've been trying for a baby for the past 5 years. No good. Once you have an ectopic pregnancy, trying for at least 6 months to a year, this is a maximum 1 year. If you don't get pregnant, then you must go to an experienced gynecologist with a good ability to investigate further and treat you properly.
Okay. walaal caasha wuxuu ku leeyahay dhakhtarku haddiiba ay dhacdo in maaragtay hadda sida gabadhaadu ilaahay ha caawinee ay macnaha u qaaday uurka uurkaasi noqdo mid ku beerma meel ka baxsan rixinka waxaa muhiima in aynan wax badan sugin 6 bilood ugu badnaan sanad gudihii waa in ay martaa full investigation baaris kaamila lagu sameeyaa oo ay mutakhasisiinta u tagtaa marka waxa uu dhakhtarku ka hadlayaa waxaa dhici kara blockade in maaragtay dariiqu xaniban yahay markaasina ay tahay in la saxo haddii taasi ay suurtageli weyso marka macnaha baaristan kaamilka la marsiiyo waxaa markaasi ay noqon doontaa in lagu beero oo mataqaanaa la abuuro ilmihii haddana dib ayadii raxinkeedii loo geliyo marka waxaa kugula talinaynaa inaad la xiriirto mutakhasisiinta ninkan ka mid yahay si ay kuu siiyaan talo waafiya Doctor, I would like to say that you talked about miscarriages.
Yes.
Vaginal bleeding can be a sign of miscarriage or premature labor, and it happens during the first trimester of pregnancy. Normal pregnancy lasts for about 40 weeks from the first day. You talked about an important that the pregnancy itself is classified into 3 periods. The first 12 weeks, then the 27 weeks. So these are, the unborn taking shape and changing from time to time. For example, you have the first trimester, you have a human form, then that human form develops, then it becomes mature until we are able to know even the gender of it. I would like to say, how can we, if we see bleeding, for example, unusual bleeding, whether it is severe or mild from a woman, what is your advice to her?
Any woman who has bleeding in pregnancy, it is abnormal. There's nothing called bleeding in pregnancy normal. And that was a question came to me from the Daily Mail, asking me, what is the benefit of bleeding in pregnancy? I said, what is the questions mean? I said repeatedly, bleeding is an abnormal in pregnancy. Therefore, there is no benefit whatsoever of bleeding.
So it is something unusual that has to be dealt.
Exactly.
Okay.
When we come to the when we come to the bleeding in pregnancy, they must understand women. While I'm talking at the moment, by going to GP or casualty and the hospital say go home and rest. I don't wish any woman to take these matters easily. If she had a scan and the scan showed a good healthy baby and the fetal heart is there, she must have some protective medications to the pregnancy to reduce the risk of this pregnancy to go into full miscarriage. Miscarriage is a serious matter. Sometimes miscarriage can be an indication of an abnormal baby. Baby is not normal, and that should be known early enough so at least the woman can get rid of and have termination of an abnormal pregnancy. Also, there is something called molar pregnancy. It's very serious pregnancy, and that is one of the early indication of a molar pregnancy, which is an abnormal pregnancy. It's not a baby. is bleeding, and that can, this kind of pregnancy can lead to cancer. Called
There is no baby.
carcinoma. There is no baby.
And
It's
the woman is
called
pregnant.
molar pregnancy, like grapes, inside grapes. It's not pregnancy. But woman doesn't know unless the doctors
Tells
have
her.
done a scan. No, they have to do a scan. The scan, as soon as the woman bleeds, she must have a scan. Full stop.
walaalayaal sidaa maqlaysaan waxaa jira uurar macnaha ama haweenku ay qaadayaan oo markaasi غير caadi aan ahayn waxaa ka mid ah mid haweentu ay ismoodayso inay uur leedahay markaasina waxba jirin marka waxaa muhiim ah oo cawada aan macnaha taabanaynaa inay daruuri tahay in isla markiiba lala xiriiro mutakhasisiinta markii qofku uu dareemo inuu uur leeyahay waxaan u malaynaynaa khadka dad badan baa ku jira ku soo dhawaa walal
السلام عليكم.
عليكم السلام ورحمة الله.
waxaan rabaa caawa waxaan rabaa inaan ka hadlo xanuun i hayo.
Ay walaal soo dhaw.
Dhinaca ultraha.
Magacaaga ama meesha ka soo hadlayso?
Waxaan ka soo hadlaa London. Magaceygana Farxiya la yiraahdaa.
Farxiya walaal soo daa su'aashaada adoo mahadsan.
xanuun wuxuu iga hayaa dhinaca ultraha dhinaca midigta. 2006 ilaa after now. every doctor aan u tagana doctor walba negative oo leeyahay hadda dhaqtada ugu dambeeya gynecology aan u tagay waxaa ultra lagu arkay in laba adi dhibac oo cadcad inay ultra dhexdiisa ku taalo waxay tahana aan la ogeyn lugtana waxay iga noqotay sida qof naafa ah lugta waa jiidaya culays badan iga saaran lugtoo dhan
Okay, yes. waa mahadsantahay walaal ilaahay ha ku saacido waxaan u gudbinahay su'aashaadii Farhiya is sister calling from London. She said I had severe pain in the uterus, the right hand side of the uterus. She said from 2006 until now I have been trying to find solutions, visiting different people. I think recently a medical inspection has found two white, marks, and she said also, I feel in one of her legs a little bit semi-paralyzed. It means I feel that it is not strong enough to function as the other. Means semi-paralyzed. So what can the doctor do for me? What is the advice? Means there is a severe pain in the right hand side of the uterus. Recent examinations have shown nobody could tell her anything. She has been trying to look for solutions. And what is your answer?
Sister Fariha, number one, there's nothing called a woman to have pain for 4 years and undiagnosed and untreated properly. That means you are going to a wrong places and the wrong doctors. Number two, a woman who has pain on the right side mean she has pain in the area where the tubes and the ovaries are. It's called right adnexia. The first important thing is, my question, this lady has had a laparoscopy or not? Because that is very important.
What is that test?
Laparoscopy is an operation, it's called keyhole surgery. They open in the belly, they go with a camera inside to find out the reason why she's having this chronic pain in the right side. It's very easy to find out the cause and then treat the cause.
If you could kindly repeat the name of the
laparoscopy.
Laparoscopy. Yes. Dhakhtarku waxa uu walaalay ku leeyahay Farxiyo ma qaadatay laparoscopy operation ka liida oo ah in la ogaado xanuunkan weyn waxa kale ku leeyahay macquul maaha muddadan dheer in dhibaato ay jirto haddana xal la heli waayo marka waxa iska cad ku leeyahay dadka la xiriiraysa maaha dadkii saxda ah wax ku sheegi lahaa marka waxaan kugula talin lahay inaad la soo xiriirto dhakhtarka ama dhaqaatiirta kale markaas isleedahay wax xallin kara okay qof kale ayaa ku jira khadka soo dhawa walaal qof kale ayaa khadka ku jira walaal soo dhawow. khadka qof baa ku jira, walaal soo dhawow. Just one of the things I would like to ask you, which sometimes I have chanced to see an article in which was written about a woman in the British Army who was sent to Afghanistan to serve her country, and she was pregnant, but she didn't know.
Hello?
She didn't. Okay.
Hello?
She didn't know that she was pregnant. The woman felt a stomach pain, severe stomach pain, and was taken to a doctor. It was only that time when the doctor told her that she was pregnant. And you yourself have been interviewed in relation to this topic
yes, I
on
remember.
ITV.
Exactly.
On ITV. farsamayaqaanka waxaan ka codsanaynaa intuu dhakhtarka noo jawaabin in kilibkaasi uu muujiyo inuu kilibkaasi gabadhaasi qaaday uurka uu dadweynaha daawadayaasha bal u saamaxayn inay la eegaan.
She's been there since March on a 6-month tour of duty there. As you said, she gave birth on Tuesday. Astonishingly, had no idea she was pregnant until she started to get very, very bad tummy aches. Went to the camp doctor who said, "You're having a baby." Now, the baby was 5 or 6 weeks premature. So astonishingly, they are both doing extremely well. Because although, yes, it's a very impressive outfit in Camp Bastion, a £10 million hospital, they don't have any neonatal care. They're not equipped to do births, let alone premature births. They've got no paediatric equipment, no incubators. I love the comment from the commanding officer who, with wonderful British understatement, said, "My team is well rehearsed in the unexpected." And I think this probably was very, very unexpected. Also extraordinary, think about what she's been doing for the past few months. As she's been getting more and more pregnant, she's been doing 8-mile runs with a 25-pound backpack on. You know, very, very rigorous physical exercise, very stressful life. And it's just given birth.
Yes, and presumably they don't have enough nappies there, that's for sure.
Not at all.
Doctor, I've been lucky enough to have 2 children. There's no way anyone could have escaped that I was pregnant. I was absolutely huge, the size of a house. How common is it for women just not to notice that they're pregnant?
Well, it's not very common. It is very rare, particularly in a society which they do have a very good antenatal care, maternity policies, proper examination of women, regular examination for women. Women health care is very advanced in Britain. But if we're talking about third world nations or nations coming with no good health care, obviously they would have a higher incidence than here. The incidence is about 1 to 2,500, which has been studied over a period of 11 years in Wales. Germans did have a higher incidence than that in one of their studies in 2002, I think 2003, but I do not rely on that studies.
And Mr. Ismail, sorry to interrupt, but I've been told, as I've been talking to people this morning, that these things called cryptic pregnancies, where there's no sign that the woman's pregnant, the woman doesn't know, actually can be caused by stress. So presumably being in war could lead to a cryptic pregnancy.
A woman who is front line, probably her mind totally preoccupied with what she is going through. In addition, she's a very healthy woman, she's very muscular, she's got good stomach, good muscles, strong enough, and the pregnancy may have shown, obviously, may have shown, but not enough for her to warrant her attention.
Okay. Dr. Ahmed, we are running short of time, and I would like you to tell us, on the 21st of September 2012, that woman who was member of the British Army in action in Helmand region, Afghanistan, was pregnant. She didn't know. She went to a doctor, said, I had a severe
No,
pain.
no.
Yeah.
No,
What can you tell us? What kind? How she
story,
couldn't live?
a story is very, very interesting, and as a result of this interview, there's a big changes happened in the British Army. This lady, she left Britain to go to the front line in Afghanistan, and I have specified following the interview with the British Army that they must be very careful in future, and must, like the women going to the front line must be examined, tested, and they have to find out whether they are pregnant.
Because finally I wanted to say a lot of thank you very much for that. A lot of nurses, paramedics, medical students, and would-be medical students are looking for a place to get into, for opportunity to get into, for example, reputable clinics like yours, to get trained and prepare for what is called internship.
Okay.
What can you do for them?
Well, obviously they are most welcome to contact me and send me their CVs.
Yeah.
And I'll be more than happy to look at it, and if the candidates are suitable enough for training, we have people coming from all over the world.
Definitely.
For internship.
Yes.
And it will be my pleasure to the Somali community.
Well, thank you very much. Yes.
Young ladies who are going to be a future either medical doctors or paramedical or nurses in future.
Thank you very much. waqtiga ayaan noo saamaxayn dadweynaha waxaan u sheegaynaa in Dr. Ahmed Ismail oo ah mas'uul weyn oo London Medi and London Gynecology Clinics kaas oo kamid ah Queen's Clinic inuu leeyahay qof alaali qofkii Soomaaliya oo ama nurses, paramedic amba dhakhtarnimo baranaya ama markaasi ku jira collegeska ama jaamacadaha waxa uu la soo xiriiri karaa asaga oo markaasi aan u saamaxaya uu leeyahay in uu macnaha meeshaydan ku tababarto intaan iska arki doona hawada usbuuca soo socda iyo wixii ka dambeeya waxaan kaga tegaynaa amaano Allah iyo amaano rasuul waqtiga oo na saamaxin dadweyne fara badan ayaa doonayay inay telefoonka kaga qayb qaataan nasiib darro waqtiga aan ugu cariiriyo waxaan ilaahay idinkaga barinaynaa dhamaantiin khayr iyo barwaaqo. I'd like to thank you very much for participating in the program.
Thank you very much indeed for Somali TV, the Kalsan TV, for inviting me, and for all the viewers. And I hope to see you again and see our young progressive female in society achieving what they want to achieve.
Thank you very much.